Hello everyone, I Dr. Shamsher Singh welcome to my SSB Pharma Learning YouTube channel. Today I am going to discuss with you about anti-arrhythmic drugs or the anti-arrhythmic agents. So what it mean? It mean which are used to treat arrhythmia. So, what is arrhythmia? Arrhythmia means whenever the rhythm of your heart is changed. So, what does it mean? It means whenever your normal contraction of the auricle and ventricle do not occur sustainedly or it is not in a continuous manner. So, basically, you know that our heart is consisted of four chambers, that is two are upper are called as auricles, left auricles, right auricles, and left ventricles and right ventricles. So basically the left side contain oxygenated blood which contain oxygen, and right side carry deoxygenated blood, so which is coming from the superior vena cava from the head and upper part of the body, and by the inferior vena cava which move from the back side of the heart and enter into the right auricle, that is called as inferior vena cava, which carry the blood from the lower limbs of the body. So basically whenever the deoxygenated blood enter here, on the simultaneously the oxygenated blood which is coming after the purification by the pulmonary vein into the left auricle is present here. So whenever the SA node which is present in the right auricle start to conduct the impulses, these impulses move from SA node to AV node and from AV node to bundle of his and Purkinje fibers. So by this mechanism, you know that at the first time due to the SA node impulse conduction, the first auricles are contracted and the blood move into the left ventricle. Again the left and right ventricle are contracted and the right ventricle blood move towards the lungs for purification by the pulmonary artery, and the left ventricular blood move into the aorta. So aorta is the largest blood vessel which supply the oxygenated blood to the body. Even though this aorta on the upper lobe contains some small vessels which are called as coronary vessels, coronary sinus, which provide the blood to the heart. So it means this is the process which is called as rhythm. So whenever rhythm is changed, it is called as arrhythmia. So I will discuss with you that what are the drugs. So arrhythmia drugs, so basically you know that this is a action potential which is generated over the myocardial fiber. So what it mean, you know that here there is a phase 0, phase 1, phase 2, phase 3 and phase 4. So this is process of depolarization, repolarization, hyperpolarization, like that. So at the initial stage here, whenever the action potential is initiated or the conduction of the nerve fiber is started, at that time there is a presence of leak sodium channel. So this leak sodium channel, whenever they are open, due to its opening, there is an increase in the depolarization. So you know that whenever you want to use sodium channel blocker, they will act on this phase of your action potential. So basically at the peak, there is a decrease in the action potential. This is due to opening of potassium and chloride channel, and little bit the knob is present here. This is due to the opening of calcium channel, and again there is a potassium reflux. So this is the process of action potential generation over the myocardial fibers, and these antiarrhythmic drug they act by blocking the myocardial sodium, potassium and calcium channels. So basically you know that this four class system, which is called as a four class of the drug, that was given by Vaughan William, and there was a Singh who was there. They classify the various drugs which can be used to treat the arrhythmia. So this is the classification of drug. You know that first classification is membrane stabilizing agent. So what it mean? It means they stabilize the process of depolarization. So they act through the three phases at the zero phase. At this phase, they act through three types, that is moderately acting, that is little moderately decreasing dv by dt. So dv by dt mean whenever there is a change in the potential with the time. So because that this curve which is produced, action potential which is produced, it is due to the voltage. So likely that it is a minus 90 to 100 millivolt. This is around 55 millivolt. This go toward the plus side, plus 30 millivolt. So in this phase 0, they want to stabilize this phase rate of depolarization. So they moderately affect this. So their efficacy is moderate. That's why they are called as moderate decrease in dV by dt at zero phase, this phase. So the drugs are quinidine, procainamide, and disopyramide. Little decrease in dV by dt. So it mean little bit less than this. Lignocaine and maxilitine marked only less effect on change in potential with time at phase 0. Drugs are propafenone and flecainide. Now, anti-adrenergic agent, because that beta receptor, they play a major role, because beta 1 receptor which are present on the SC node and the wall of aorta. So that's why the beta blockers which are used, they are propranolol, esmolol, sotalol, like that. Agents widening AP. So what it mean? It mean they wide this particular process, this effective refractive potential. So agent widening, it means these are the agent which provide that reduce the oxygen demand and improve the efficacy of the heart. So these are amiodarone, dronabinol, dofetilide, ibutylide, like that. And there are calcium channel blocker, verapamil and diltiazem. So this is the four classification system which was given by the Wagum William. And after then the new addition was there, that was the drug which affect the proximal supraventricular tachycardia. This was adenosine and digoxin. And drug for the AV block, auriculoventricular block at the AV conduction, they are sympathomimetics like isoprenaline, anticholinergic, atropine, like that. So this is the classification of the drug which are used to treat the arrhythmia. So I will discuss about the first class. You know that the first class, they interfere with the sodium potassium conductance, because that at this phase, whenever there is a entry of sodium in the myocardium fiber, there is a efflux of potassium. So this is the process of depolarization. So that means this depolarization can be changed either due to abnormal conduction of the impulses by the SA node, either you are taking such type of the agent which are CNS stimulant, excitotoxic agents, or the agents opioids which are used at higher concentration. So that's why these are the first class. The subclass of this is quinidine, which which is acting by opening state of the sodium channel. So that means that sodium channel, whenever a drug like ligno can also act on the sodium channel, but quinidine, what it cause? It increase the open state of the sodium channel. So that means it prolong the time of opening. So whenever the time of opening of this channel is prolonged, then that there will be a less entry of sodium and there will be a stabilization of the nerve conduction. Now this quinidine, this question can be asked in the GPAT, that quinidine is a dextroisomer of quinine, and that quinine is a anti-malarial drug, but quinidine is a anti-arrhythmic drug. So at the same time, both are obtained from the cinchona. So they are the active part of the cinchona bark. And how this quinidine act? You know that quinidine block the sodium channel, reduce automaticity, and increase or maximize the rate of phase 0 of depolarization. So it is a very simple mechanism. You know that whenever there is an entry of sodium, exit of potassium, this is a phase of depolarization. So this is a very simple. So they prolong the action potential duration. So what does it mean? It mean, I will show you here as an example. that whenever the action potential is initiated, this is due to the opening of firstly leak sodium channel. So that's why you know that our heart never go for rest. The reason is these leak sodium channel always they provide sodium, influx of sodium, leakage of sodium. So action potential will be delayed, that means slowly will be increased, and they will maintain the nerve conduction. So what are the adverse effect of these type of the agents? Basically these agents are quinidine is a safe, but even though you know that it is having a weak alpha adrenergic blocking property, that's why little bit it cause fall in the blood pressure. Other neurological disturbances that are due to it is some, you know, that affecting or altering the cholinergic sympathetic tone, that is ringing in the air, that is called as tingling like sound, and vertigo, deafness, visual disturbances, and it causes synchronism. This can be also asked in the GPAT, what is synchronism? The synchronism is a combined symptoms, like there will be a headache, there will be a red flushing on the faces, and there will be a tingling like sound in the air, disturbances of vision. So this is called as synchronism. That is the, you know, problem with the high dose intake of syncona. Now the drugs are useful for torsade D point and sudden cardiac arrest, and in case of vascular collapse or some other conditions. So next is a procainamide. It can also be used. This question can be asked in the GPAT. It is a amide derivative, first thing. And second thing, it is a amide derivative of procaine. So you know that procaine, which is a cocaine, procaine, lignocaine, these are the local anesthetic. So it is the amide derivative of this procaine, which is called as a procainamide. So likely quinine, procaine is a local anesthetic, procainamide is an antiarrhythmic drug. So this also you know that it also cause action potential and duration prolong, effective refractory potential prolong on QRTC complex. So I will show you here what does it mean. So how it is acting. So basically this is acting, suppose this is called as a PQRST, which is a one phase of, you know, that this cardiac output, cardiac cycle. So this QPQRST. So you know that it interfere with the QRS, this phase. So that means if this phase is more sharp, if it is more sharp, likely you see in the ECG, suppose if you see in the ECG strip, अगर आप देखें तो ECG strip में अगर आपको जितनी ये R wave जितनी sharp दिखाई देगी, इसका मतलब कि उस patient का ventricular contraction rate fast है. It mean there is a reduced APD, action potential जो ड्यूरेशन है, और जो क्यू आर एस ई आर पी इफेक्टिव रिफ्रैक्टरी पोटेंशियल जो है दैट इज इंक्रीज. So it widen this, this will take a more time. It is the basic mechanism of this procainamide. So it is also important for the GPAD that antivagal action is absent. This procainamide do not produce a vagal action. Vagal mean release of acetylcholine. It is not a alpha blocker. Likely you know that quinidine was having alpha blocking property, but procainamide do not block the alpha receptor. So this is also useful. Now the another thing which is very important, that pharmacokinetic. It is important that it is metabolized in the liver and it undergo acetylation in the and converted to NAPA. So NAPA can be a question in the GPAT, that is N-acetyl procainamide, which is the active constituent which is responsible for the pharmacological action. Plasma T half is 3 to 4 hour, and some GIT problems can be caused by this procainamide, even though this is used intravenously for in case of monomorphic ventricular tachycardia and supraventricular arrhythmia. So basically this is useful for in case of AV conduction changes. So next is a disopyramide. Disopyramide, likely you know that it is a class 1 agent which is not having a alpha adrenergic blocking property, but even though this is also a sodium channel blocker, and some adverse effects are there. These are due to some cholinergic property. So procainamide and quinidine do not have vagolytic action, do not have anticholinergic action, but this drug produce some anticholinergic action. This is also important as per your GPAT. So it causes dryness of mouth, constipation like that, blurred vision. So this is a second line drug for the prevention of ventricular arrhythmia. First line is procainamide. So this is a class 2 agent. So you know that class 2 agents, class 1B, they are also a sodium channel blocker like lidocaine, which is called as a lignocaine. So lignocaine is a local anesthetic which is known by the name of lidocaine, and it is a amide derivative, and also you know that it cause longer action potential duration. So what does it mean? It also increase this QRS phase. So that means it provide a time for the ventricles to contract, and it improve the efficacy and the working capacity of the ventricle. In term, it also improve the, you know that there is a increase in the blood entry toward the ventricular side, so ejection fractions can be improved. So this is the pharmacokinetic. The T half is approximately 10 to 20 minutes, but some adverse effect like paresthesia. So this is paresthesia. You know that it is a type of tingling like sound in the internal ear of the humans, like, and this cause blurred vision, and this cause nystagmus. So this nystagmus can be there. This is due to the excessive twitching, blinking of the eyes can be there by the use of this drug. So this is also suppress the ventricular tachycardia, and this is a good, that good drug in case of emergency. So next is a class 1C, which is a propafenone. Again, these class 1, 2, and 3 of class 1 are sodium channel blocker, and this is useful for the Waugh-Parkinson-White syndrome. And in this case, propafone used in ventricular arrhythmia, it again affect the action potential duration and is a sodium channel blocker agent. This is called as a class 2 of antiarrhythmic drugs. So the class 2 is a propranolol, which is also an antihypertensive drug, which is also used add-on along with antithyroid drug. So this class 2, which is called as a propranolol, they are the beta blockers, and I have discussed that alpha receptor, which are called as adrenergic, and beta, they are called as adrenergic. Alpha 1, they are present on the smooth muscles of the blood vessels and even though on the kidney, and beta 1, they are also present in the kidney as well as in the aorta and in the lungs. So basically you know that these alpha beta receptor, they cause blood vessel constriction and increase the preload on the heart side, and beta increase the contraction of the heart. So you know that this propranolol is a non-selective beta blocker which reduce the beta receptor dependent increase in the preload and reduce the contraction or depending upon the SA node. So this is also an anti-arrhythmic agent, and this is used for the re-entry arrhythmia. So you know that re-entry arrhythmia, whenever the nerve, whenever the nerve will again cause contraction of any particular part. Suppose this is from auricle to ventricle, and this is going toward this side, and again after the blockage of this area either due to myocardial infarction, this wave of contraction move again toward this side. This is called as re-entry phenomena, recontraction of the heart. So this is a useful drug. Then there is a class 3 antiarrhythmic agents. So class 3 antiarrhythmic agent, you know that amiodarone, this is a type of drug, and this drug also prolong the phase of repolarization, and action potential is widened, and effective refractory potential is increased. So what does mean? They act on the phase 3. So this amiodarone, which is a anti-arrhythmic drug, and you know that it act by delaying the rectifier potassium channel. So it block the potassium channel. You know that whenever there will be opening of potassium channel for a long time, it can cause delayed after depolarization. So this delayed after depolarization is one of the problem with long term opening of the potassium channel as the phase 3 of the action potential generation. So this amiodarone, which is a good lipophilic agent and useful antiarrhythmic drug, and it contain iodine structurally. So what are the use? It is used for the supraventricular arrhythmia and proximal supraventricular tachycardia, nodal and ventricular tachycardia. So this is a useful drug. Little bit adverse effect with the amiodarone are fall in the blood pressure. So bradycardia can be there and it can cause myocardial depression on intravenous injections. So this is a class 4 agents, antiarrhythmic. They are called as calcium channel blockers, and they block the L type of the calcium channels, which are called as long lasting longitudinal type of the calcium channel, the channels which are present on the myocardial fibers of the heart. So basically you know that calcium is also responsible for the calcium dependent calcium calmodulin complex formation and muscular contraction, and these calcium blockers like verapamil prolong AV nodal ERP, effective refractory potential, and AV conduction is slowed down, by which they act on the PR interval. So you know that this is a PQRS, this is a PR. So what does it mean? They will increase the time for the contraction of the auricle and shifting of the impulse from auricle toward the ventricular side. So this is called as PR phase, and they are useful in re-entry phenomena of the AV node. So that means these type of calcium channel blocker are useful for the arrhythmia associated with the myocardial infarction or due to the coronary sinus blockage. So this is a verapamil. It is useful in post supraventricular tachycardia, and it is given 5 mg intravenously for 2 to 3 minutes, and it is effective in 80% of cases, not in all. This can be a, you know that verapamil is not effective in all the patient because genetically some of the patient may not be supposed to show a better effectiveness toward the verapamil. And the drugs for the proximal supraventricular ventricular tachycardia. This is the another addition of the drug in the classification of antiarrhythmic agent. So adenosine, you know that it is a one of the nucleoside, and along with, you know, it is given intravenously, and it is a short acting. That's why the adenosine is not a better therapy. It can be a therapy at the time of emergency or for the short time, because its T half is only 30 seconds and it can be effective for maximum 1 to 2 minutes. So that's why adenosine is, this is the major question sometime asked in the GPAT, that which is the short acting antiarrhythmic agent, and this adenosine is a well known example of that. And you know that adenosine activate the acetylcholine sensitive ACS sensitive potassium channel and responsible for the hyperpolarization, thereby reduce the SA node dependent, you know, action potential generation and the myocardial contraction, and responsible for the bradycardia. So there should be a one of the thing you should note on that this type of adenosine molecule never be used in case of complete auriculoventricular block, and in case of CHF, or in case of myocardial infarction. So that's why another is the drug for the AV block, which is called as atropine, which is an anticholinergic drug. And you know that whenever there will be a AV block, auriculoventricular block, we always give a such type of drug like dopamine, dobutamine, or some other agents we give, so that they increase the conduction of the contraction of the ventricle or initiate the ventricular contraction. So that's why atropine, which is an anticholinergic drug, and thereby it reduce the acetylcholine dependent vagolytic action on the heart, and on the other side increase the sympathetic tone and initiate the ventricular contraction. Another drug for the AV blocks are sympathomimetic agents like dopamine, dobutamine. Adrenaline nowadays is not preferred, then isoprenaline is there. So these are the drugs which I have discussed with you. So these are the choice of the antiarrhythmic agent. So which type of condition is there and how you choose the particular antiarrhythmic agent. So for the arterial extrasystole, that in arterial overcontraction, propranolol sim, symptomatically used. And in PSVT, proximal supraventricular tachycardia, if you are choosing IV, adenosine, verapamil, diltiazem, esmolol. If you are choosing oral therapy, then verapamil, diltiazem, propranolol, sotalol. Atrial fibrillation, IV for amiodarone, sotalol, and amiodarone and dronedarone like that. Oral is verapamil, diltiazem, propranolol. In case of arterial flutter, there is a propafenone and verapamil. In Wolff-Parkinson-White syndrome, there is a propafone in combination with verapamil or amiodarone along with sotalol, or amiodarone or a sotalol. And in case of bradycardia, atropine intravenously is given. And in case of ventricular tachycardia, propranolol or amiodarone orally is given. So these are the agents, these are the questions which are very useful for your preparation, and these are the agents which are used as an antiarrhythmic drug. Hope this lecture was very useful for you all, and in the coming time I will discuss more basic concept of the pharmacology along with the various drugs which are used, as well as some of the important questions of the GPAT as I have discussed here. So you always like, watch, subscribe the channel, and you are welcome. Thank you very much.